SPTA Katie Whitcomb, and this is Kicks with Ticks. We're here to talk about tick-borne illnesses, and today we're going to talk about Lyme disease. Lyme disease is the most common tick-borne illness in the United States, and it is caused by the spirochete bacteria Borrelia burgdorferi. This is a spirochete bacteria because of the shape of a spiral. So it has a nice corkscrew kind of shape. That's why it's a spirochete bacteria. In the U.S., the deer tick or black-legged tick can carry the disease and spread it. And here's a picture of a black-legged tick. It is one nasty-looking bug. I wouldn't want one of these crawling on me. Humans become infected when ticks carrying the bacteria feed on them. Ticks have to be attached to the human for 48 to 72 hours or more to cause infection. The tick that is attached feeding on the human injects its saliva that contains the bacteria into the human. The bacteria can now enter the human's bloodstream. The bacteria then travels to organs and the lymphatic system through the bloodstream. The bacteria disturbs local immune responses in numerous areas throughout the body, thus affecting multiple systems. If the disease is left untreated, it can survive in the human body for years. This can cause numerous problems. Most infections of Lyme disease occur in the late spring and summer. This is because humans participate in more outdoor activities during these times, and ticks are also more active. Children 5 to 10 years old are infected twice as often as older individuals. Cases of Lyme disease also occur most often in heavily wooded areas. The New England region in the United States has the highest frequency of reported cases of Lyme disease. Yet another reason to stay and live in the South. Prevention is key for Lyme disease. Keeping grass cut, clearing brush and trees, and removing leaf or wood piles can help. Using an insect repellent that contains DEET, like this, and reapplying every 1 to 2 hours also helps. Treating clothing with permethrin is very effective because it kills ticks on contact. Skin and clothing should be checked after possible tick exposure. If a tick is found to be attached, it should be removed using tweezers and pulling it straight out of the skin very gently. Lyme disease can be diagnosed using a two-step process. First, an immunoassay blood test is performed to determine if antibodies to the bacteria are present in the blood. If this test is positive or inconclusive, a Western immunoblot test is performed, and this test can confirm the diagnosis of an infection of Lyme disease. These tests may not be positive until a few weeks after infection, since antibodies do not form immediately. If the erythema migrans rash is present, this test does not have to be performed for a positive diagnosis of Lyme disease, and we'll talk about this rash in just a minute. A single dose of doxycycline between 36 and 72 hours after ticks have attached can prevent the disease. This treatment is 87% effective in preventing the infection. There are 3 stages of signs and symptoms of Lyme disease. The first stage is 3 to 32 days after initial infection. Skin lesions at the site of tick bite occur. The skin lesions are called erythema migrans. And here's a picture. And the rash itself looks like a bullseye because it has a darker area, a lighter area, and a darker area around it. So this rash can resolve in 4 weeks even without treatment. Impairments in early stages include fever, chills, joint pain, headache, and fatigue. Sounds pretty miserable to me, but it gets worse. The second stage is just a few days to a few weeks after the initial tick bite. Neurological symptoms start to occur. This may include symptoms such as stiff neck, mild headache, radiculopathy, and problems with mental activity. These symptoms can last for weeks or months and can reoccur. Lyme arthritis can also develop in the larger joints of the body. It can last for hours or days, and if the disease process continues, it can last weeks to months. If Lyme disease is left untreated, flare-ups or chronic Lyme arthritis can occur in single or multiple joints. And cardiac impairments can also occur. Symptoms include dizziness, fainting, shortness of breath, and slow, rapid, or irregular pulses. The third and final stage of Lyme disease occurs weeks to months after the initial bite. Symptoms of this stage include fatigue, severe headache, muscle or joint pain that is widespread, and cognitive issues. These impairments can continue months to years, even after treatment. That's just awful. Oral antibiotics such as doxycycline or amoxicillin are given 14 to 21 days to treat bacteria after a confirmed diagnosis of Lyme disease. The IV antibiotic ceftriaxone may be used for 14 to 28 days if a heart block or neurological symptoms are present. If Lyme disease is treated early with antibiotics, the prognosis is excellent in most cases. Symptoms will resolve totally within a few weeks or months. NSAIDs and disease-modifying anti-rheumatic drugs can be used to decrease arthritis pain. And immunity from Lyme disease does not develop, so a person can become reinfected if they're exposed again. Pain, decreased strength, decreased range of motion, abnormal gait, and limitations in daily functions can all be addressed with physical therapy interventions. Interventions can include strengthening exercises, range of motion exercises, and gait training. Low-intensity resistance exercises may be beneficial to individuals who have persistent symptoms of Lyme disease. Physical therapy can improve the quality of life and decrease pain symptoms in individuals infected with Lyme disease. Fatigue is a major factor with individuals infected with Lyme disease, so exertion should be monitored closely during physical therapy. Longer rest breaks may need to be given to make sure overexertion does not occur. And to wrap things up, Lyme disease is multifaceted and can cause numerous problems throughout the entire body. Preventing it is key, but if that fails, oral antibiotics are your best option. Even though symptoms may subside or resolve with antibiotic treatment, they may reoccur or persist for months or years after infection. Lyme disease can become a chronic problem. Physical therapy can help with many impairments caused by Lyme disease and can help individuals feel more energetic, become stronger, more mobile, and have less pain. Physical therapy can create a better quality of life for individuals with persistent symptoms of Lyme disease. To make a long story short, stay away from ticks, wear bug spray, get antibiotic treatment if you become infected, and find an awesome physical therapist. Tune in next week to watch as we talk about another tick-borne illness called Rocky Mountain Spotted Fever. Until then, be safe and tick-free, my friends!